When you have rosacea, it can be really easy to fall into the trap of thinking that treatment of premature aging is not for you, that your skin is too fiddly, too tricky, too temperamental to tolerate any of those exciting active ingredients that we're always hearing about. But today's video is to show you that there is a way forward, a journey I've taken many of my rosacea patients on, and a journey I've gone on myself with my own tricky, finicky, redness-prone skin. So I want to show you that it's a situation where rosacea-prone patients are often really helped because the very fact that light skin tends to be the commonest skin type that's affected. It's the type that's most at risk of UV damage, and in fact UV exposure is thought to be a common trigger for rosacea. So we really want to be able to get those ingredients onto the skin that are going to help firm up the skin and protect it and future-proof it. So I'm going to take you through a morning and nighttime routine discussing typical ingredients one might want to incorporate to tackle premature aging, and discuss whether or not they're suitable for you if you have rosacea, or the tips and tricks I might use with my patients to get them using these kind of ingredients. So starting with the morning routine, which is all about protecting the skin against environmental aggressors like UV and pollution. But equally important, you want to do no harm. So first things first, what I use and what I recommend is a gentle cleanser. So Flawless Cleanser is my go-to, but equally you might use La Roche-Posay Toleriane Dermo Cleanser if you're super sensitive. It's more of a lotion wipe-off cleanser with a gentle cream formulation, but I like Flawless Cleanser for my first thing in the morning cleanse. Then you want your moisturizer and your sunscreen. So basically your toolkit to support any additional products that you're going to use in your skin. I use Flawless Moisturizer. It tends to have a really nice barrier protecting effect with the niacinamide, with the shea, with the squalene, and it's well tolerated, and as I say, supporting that barrier function that we know is so important in rosacea. And then a mineral sunscreen. So I use Gossamer Untinted if I'm wearing makeup, or Gossamer Tint 1 if I'm using not using makeup. And that's mineral sunscreen tends to be the best tolerated, doesn't tend to irritate, and this is a very soothing formulation with sodium hyaluronate, shea and squalene again. So that's your scaffolding, that's your structure upon which to hang your active skincare. Now, first things first, let's talk about antioxidants. And vitamin C tends to be the first one that we think of. Now, when I'm building this kind of routine for my patients, the assumption is that the rosacea, the active part, is under control. So oftentimes they'll be using azelaic acid, and I'll build them up to twice a day, because that gives me a good sense of where their skin is going and how much they're going to tolerate. Some patients will struggle with that. And if that's the case, then there's a bit of a red flag in my mind that they may not be ready yet to evolve their routine into a more beautifying one, shall we say. But if they're fine with azelaic acid twice a day, they've noticed a big change in their skin, it's behaving much less sensitively. And I do think that there is a role for azelaic acid in increasing skin's receptiveness to other actives, because it dials down that kind of flary, inflammatory process. So vitamin C might be the first thing you think about adding in. We want to extra support that UV protection that you're getting from your sunscreen, and vitamin C is a great way to go. Now, L-ascorbic acid in its pure form is the vitamin C form with the most evidence behind it. However, to get it into the skin, the pH has to be low, so usually around 3.5. That can really sting when you've got rosacea. So it is something to consider. Some patients will handle that, and that's fine. For others, we need to think about vitamin C esters. A bit less evidence, but the likelihood is they're doing a similar thing in the skin, but they're easier to formulate with. They aren't formulated with that same low pH. And they're just better tolerated. So ascorbyl glucoside that we use in Brightly serum alongside the 10% azelaic acid is a really good example. And I think it is a great thing to add into your skincare routine if you have rosacea. So you're really building some strength and support to help prevent against the environment. The next active to think about would be niacinamide. Again, I love it for a morning routine. It essentially recharges the skin cells and provides them with energy, which allows the skin cells to defend themselves better against the environment and ultraviolet. But it also has a calming effect. It's good to prevent blemishes and inflammatory lesions of any sort, so it's helpful in calming the rosacea bumps too. And it's good for hyperpigmentation. So really, again, what would be the reason for not using it? So most calm, controlled rosacea-prone skin will find niacinamide tolerable. I typically recommend 5 to 10%, highly effective. And again, it can be built into your moisturizer or your sunscreen. It doesn't have to go in a separate serum unless it's built into the formula, for example, like with Brightly. So again, a great one to think about, great for boosting barrier function, and certainly worth trying once the acute flare of your rosacea has calmed down. Now, other things that we would think about doing with the morning routine, we sometimes think about tackling hyperpigmentation. It's not uncommon for someone to have both redness and pigmentation. It might be melasma, it might be some sunspots on the cheeks. Now, azelaic acid, as I've talked a lot about, is obviously a great active ingredient for pigmentation, so that is hopefully already doing some of the work there. In terms of additional ingredients, I don't tend to use hydroquinone so much in rosacea-prone skin, but other actives you could think about using arbutin as well, tolerated. I think it's a bit gentler than hydroquinone. AHAs and PHAs for texture, and I guess for some benefits in hyperpigmentation, I find less helpful, and I think potentially their irritation factor is a little bit higher than, for example, azelaic acid, and its benefits are not so profound. So I don't really tend to use AHAs or PHAs at all in the management of rosacea patients with aging concerned skin. So that's one I just put to the side. And then I guess it's worth mentioning hyaluronic acid because people consider it as an active ingredient. I myself don't. I think it's a moisturizing ingredient. I think the best place for it is in fact in a moisturizer. But if you are particularly wedded to your hyaluronic acid serum, you could put it into the routine at this point in time. But honestly, my best advice is seek out a moisturizer that has it built into it already. It doesn't really warrant a separate step in its own right. It doesn't have any additional benefits in terms of targeting dermis changes that we associate with aging. It's just a good moisturizing ingredient, ideally to be used in a humid environment. So we come on to nighttime, and we typically associate nighttime with regeneration and repair. And I think it's a really common question to ask. I have rosacea, should I be using a retinoid? Is it okay? And I have to say that as I've been practicing for longer and looking after more and more rosacea patients beyond the management of the acute condition, and really just then into sort of skin conditioning phase, I'm always pleasantly surprised how well rosacea patients can do on retinoids. And, you know, in the clinical setting, we're often using prescription retinoids. So I think it's all about how you introduce them and what you're using alongside them to mitigate for some of the irritation that can happen at the beginning. It really is all about getting a smooth transition to using a retinoid regularly and really committing to the slow path. There is no fast track to retinoid use when you've got rosacea. So typically the patient will be using azelaic acid twice a day. We might even have them on azelaic acid and Soolantra. And I think transitioning onto the retinoid, you can do either combination. You can keep them on Soolantra in the morning, start the retinoid at night, or similarly azelaic acid and the retinoid at night. And certainly in context of clinic, we'll often start out with differin or adapalene as what I call the litmus test to whether or not retinoids are going to be possible in terms of how, you know, the journey has been so far. If someone's been really intolerant to using azelaic acid, I might have to manage expectations and really just focus on things like vitamin C and niacinamide. But if somebody has redness, but is perhaps also acne prone and has premature aging, then I'm more inclined to think, you know what, let's just get the retinoid going. Let's not worry about vitamin C or niacinamide. Let's just focus on the retinoid because that's potentially got the most upside when it comes to improving the signs of aging, fine lines, pigmentation, uneven texture. So we'll often start out using the retinoid every third night, lots of buffering with moisturizer before, even the sandwich technique with moisturizer over the top, and really just almost try to seduce the skin, barely let it know that there's a retinoid going on, because you're kind of hedging so much with these sort of tips and tricks to improve retinoid tolerance. But over time, as I say, it is a longer period of time. Building up to daily use perhaps might take 6 weeks, but that's completely fine. This is a strategy for the long-term health of your skin, and it's really consistent with how retinoids act. I mean, I really don't assess my patient's progress until after 3 months of committing to a regime, so there is no rush whatsoever. So imagine azelaic acid in the morning, perhaps differing at night. Over the counter, it could be retinaldehyde or retinol. Start with a low percentage. Ideally use a product where you have transparency in what the percentage is, so you know you can build up over time. As I say, oftentimes I will use differin, and then 3 to 6 months later, we might well be looking at starting a low percentage of tretinoin. And I think particularly in those patients who really want that dermal redensification, that's the route that I'm hoping that we can get that patient onto, because I think that's when they do really well. And the transformation in the skin becomes really profound. So yes, you can use retinoids. They may even have some additional benefits in rosacea, provided we don't irritate the barrier too much, because that retinoids benefit almost all skin conditions. It is just about the technique that you use to get them going. Nightly serum is great because you've got the balancing act of the gram-active retinoid on the one hand, but with the azelaic acid and niacinamide on the other. So you've actually got a really balanced preparation, retinoid plus anti-inflammatory benefits, which again, I think really improves the tolerability and gives great results in rosacea-prone skin. But whichever retinoid you use, go slow, be patient, and only introduce that one active at the time. I really think that's the key to managing any problems you're going to have arising, by only having one variable in your routine at the time. So I've talked a lot about different actives, and I think the route to go, I would tend to always think about starting a retinoid first, if it's at all possible. So I think if your skin is in good shape, but you really want to get to grips with signs of sun damage, then I think a retinoid is the best next step. But if your skin is still a little temperamental and you're just sort of testing the waters, then vitamin C and niacinamide are the best ones to consider. Flares of rosacea are going to happen, is the nature of the condition, but I don't really think that stops you going forward with these kind of skin conditioning ingredients. You just basically accept a setback, and you go back to using the calming rosacea ingredients that were helpful in the first instance, whether that was Soolantra, Metrogel, Rosex, whatever it was. And then you just phase the actives back in again once things are calmer, once things are more settled, once the triggers have been removed. And that's the way you approach it long term, really. And I think in the end, you really get to know your skin. You know what it needs at a given time. You know that if you've gone away on a sunny holiday and you're on a boat, it might flare up a bit. So you take a step back and you anticipate these things from happening, but it becomes manageable, and that means less anxiety because you're in control. I hope these 2 videos on rosacea were helpful. Please leave me any comments down below if there's things I haven't covered and you have rosacea, and we'll get to those in the comment section. But for now, bye for now.